What does persistent ear pain from an eardrum perforation feel like? Imagine the sensation of your ear throbbing or aching long after an injury or infection. That's often what persistent ear pain from an eardrum perforation feels like. When the eardrum tears, many people initially experience a sharp, sudden pain that can be quite intense. This pain might be so strong that it feels like a stabbing or burning sensation inside the ear. Sometimes, it's accompanied by bleeding or a feeling of fullness or pressure. If the perforation happens because of an infection, you might notice that the pain builds up gradually before the rupture, due to pressure from fluid or pus in the middle ear. Once the eardrum tears, the pain often lessens suddenly because the pressure inside the ear is relieved, but that does not mean the problem is over. After that initial pain eases, many people notice a dull, aching discomfort that sticks around 4 days or even weeks. This lingering pain can feel like a constant dull ache or a sense of soreness deep inside the ear. It may come and go or stay steady, especially if the perforation is slow to heal or if an infection persists. Sometimes, the pain is worse when you move your head or touch the ear. Along with the pain, you might experience other symptoms such as hearing loss, which can range from mild muffling to more significant impairment depending on how large the perforation is and whether the middle or inner ear is involved. You could also hear ringing, buzzing, or other noises called tinnitus. Itching or irritation inside the ear canal is common too, especially if there is an ongoing infection or inflammation. Fluid discharge from the ear is another sign to watch for. The fluid might be clear, bloody, or thick and pus-filled if an infection is present. Some people also experience dizziness or vertigo, which is a spinning sensation, especially if the inner ear or balance structures are affected. The persistent pain may also be a sign that the ear is not healing properly or that a secondary infection has developed. If the pain continues or worsens, it's important to see a healthcare professional. They can evaluate whether the perforation has healed, if there is an infection, or if other complications like damage to the tiny bones in the middle ear are involved. From a hearing health perspective, ongoing pain indicates that the protective barrier of the eardrum has been compromised. This can make the middle and inner ear more vulnerable to infections and damage, which can sometimes lead to permanent hearing loss if not treated properly. If you notice persistent pain, along with changes in your hearing or ear discharge, it's essential to consult an ear specialist. They can provide the right diagnosis and treatment plan to help protect your ear health. Remember, every person's experience can be different, so seeking personalized medical advice is always the best course of action. In summary, persistent ear pain from an eardrum perforation often feels like a dull, aching discomfort following an initial sharp pain. It may be accompanied by hearing loss, ringing, ear discharge, and sometimes dizziness. This ongoing pain usually signals that the ear is still inflamed, infected, or not healing fully, making prompt medical attention important to preserve your hearing and overall ear health.